Tom Thomas and his wife arrived in Canada from India 5 years ago, both registered nurses with big dreams, now dashed by COVID-19.
It's a difficult situation.
Childhood friend Don Paul speaks for the family. He says Thomas was working as a care aide at this psychiatric hospital in North Battleford, and as a frontline worker got the first dose of vaccine in early February.
He was happy to get the vaccine, just so that way, he can protect and take care of others, right? So he was quite happy.
But just 24 hours later, Thomas was told he'd been exposed to the virus inside the hospital where there was a confirmed outbreak. He tested positive, isolated from his family, then went to the emergency room with chest pain. The 34-year-old died from cardiac arrest on Monday.
My condolences to the family. This is a young fellow, a hero on the front lines of delivering health care in the province.
The Premier spoke about Thomas's death while unveiling a mass immunization clinic in Regina, one of hundreds of locations prepared to dole out thousands of vaccines as fast as they arrive. But until then,
we need to keep our guard up.
If you pick up any disease in the first 2 weeks after the first shot, it might mean that you've been exposed before that first needle.
And even after the first dose, research suggests there's no real protection for at least 12 days.
Although you may only get 50 to 80% protection starting about 2 weeks afterwards in that initial phase, your protection from severe disease or dying is almost 100%.
Meanwhile, Don Paul is a healthcare worker who's waiting on his second dose that's been delayed.
I was supposed to get it, but haven't received it. So just a little worried.
For now, he's focusing on funeral arrangements for his friend. He's raised more than $90,000 through GoFundMe to support Tom Thomas's widow. They plan to send his ashes home to India to be buried in the family cemetery. Bonnie Allen, CBC News, Regina.